I'm David Schweitzer, and I'm 67. Well, when I had atrial fibrillation, my symptoms, I had them quite often, and to tell you the truth, they kind of scared me. My heart would always race. I was told Afib didn't always cause racing, but in me it did. It would get as high as 200 beats per minute, and it was, of course, very irregular. It was hard to breathe. Sometimes I perspired, but mostly it was just a real irregular heartbeat, real fast heartbeat. And I had to stop whatever I was doing for a few minutes because I couldn't hardly think, to tell you the truth.
Atrial fibrillation is one of the commonest electrical abnormalities in the heart. And atrial fibrillation occurs where the upper two chambers of the heart, instead of pumping normally at 60 or 70 beats a minute, are going 400, 500 beats a minute. So there are two problems with this. Problem one is that the lower chambers pump fast and hard, and most patients will feel that their heart is racing. And the second problem, which is the bigger problem, is as the upper chambers pump 400 or 500 times a minute, blood stagnates. And as blood stagnates, it can form a blood clot. If the blood clots break loose and go to your brain, you can have a stroke. So atrial fibrillation is one of the commonest causes of stroke.
Well, the medicine and blood thinners just didn't do much for the symptoms. I still had the symptoms. The blood thinner, of course, was to help me not have a stroke and die when I went in and out of Afib. They didn't do much for me. No, I didn't like them much. And the thought of taking them for the rest of my life, I didn't like that idea at all. Years and years ago, 67 was old. It's not anymore.
So David had very symptomatic atrial fibrillation. He was on medications including blood thinners as well as other medications to reduce his heart rate, but he still felt the palpitations. He still felt that his heart was racing. And when someone in atrial fibrillation fails to have control of their symptoms because of their heart racing, then they could be candidates to have a procedure that David underwent. David underwent a procedure called pulmonary vein isolation or atrial fibrillation ablation. This is a procedure that has been in cardiology and been performed for over a decade now. And what this does is it's a way of modifying or electrically modifying the back of the heart so that atrial fibrillation doesn't recur and patients return to normal rhythm.
My recovery from the procedure was so much quicker than I thought it would be. When I woke up from the surgery, I had a little pain here. Actually, they ended up giving me Tylenol, nothing too big, and it just took care of the pain. I got home. I did fine. I went home the same day I had the surgery, and I was already retired, so I didn't go back to work, obviously. But I went back to everything I wanted to do, and it was just day surgery, in and out, felt great. And the best news is I have never had Afib again in the 2 years after I've had the surgery. I'm off the blood thinner. I got off the blood thinner almost immediately. And I have an implant to make sure I don't go back into Afib, so Dr. Bala will know immediately if I do. And so I won't have a problem with the Afib if I go back in. But I haven't, and I just don't think I ever will again, and I'm so excited about that. I was glad to have the surgery. I was so glad Dr. Bala recommended it. The surgeon did obviously a great job because it worked so well, and a fast recovery, just nothing to it. I only stayed that one day in the hospital. Best I remember, it was day surgery. I had it pretty early one morning, and like I said, it was so long ago, 2 years for me, but it was day surgery. I was in and out one day. Dr. Bala stopped the blood thinner pretty quickly after it. To be honest, I don't remember exactly, but the best I remember was I went in pretty quickly for a checkup with Dr. Bala after the surgery. I know it wasn't very long, maybe a couple of weeks at the most, and he took me off of it immediately, and we did the monitor implant right after that. And like I've said before, it was a little bitty thing. You just stuck it right in there, nothing to it. I went home. I was there about an hour to have it done. And Oh yeah, and I was so glad because I know the blood thinner can have problems in itself. So, well, you bleed for a long time. For one thing, I cut myself now and I hardly bleed, but oh yeah, just almost right away. I would absolutely recommend Dr. Bala and Orion Medical to family and friends. In fact, I already have done that. Most of my friends are around my age, so they're having little problems too. And I tell them just immediately, I said, "Oh, I've got a doctor for you." And I take out my pen and pencil, write down his name and phone number. I said, "You call that man. Not only is he smart, he's a nice guy. You can talk to him just like we're talking right now. And he will get you immediately if you have any problems." And he refers you to wonderful doctors that take care of you too, perfectly. I had that surgery and it was just wonderful. And I didn't think I'd ever say that about a surgery, but it really was.
So that's a really important issue that you bring up with atrial fibrillation. And I get asked this several times by patients, "Doc, will I ever be able to stop my blood thinners because of this atrial fibrillation?" And the answer is yes. In selected patients who have undergone atrial fibrillation ablation, who have returned to normal rhythm and remain in normal rhythm for several months after the procedure, we have been successfully able to take them off their blood thinners as well as keep them in normal rhythm.